Hi guys, this is our lab review of Lab 8, Posterior Thigh and Gluteal region. To start this off, we're going to look at the lumbar plexus and the sacral plexus. And so really this is looking at innervation of the gluteal region, posterior thigh, anterior thigh, and then leg and foot. And we'll expand on the leg and foot a little bit more. But for the posterior thigh, gluteal region, anterior thigh, really we're concerned with just a couple of main nerves, the femoral nerve for the anterior thigh, the obturator nerve for the medial thigh. And then as we look at the sacral plexus, the gluteal nerves, and then for the posterior leg, posterior thigh, we'll be concerned with the sciatic nerve. And so just to start off, we have the lumbar plexus. Remember, at the bottom of the spine, we have the lumbar region. So L2, L3, L4, and then L5 is the last part of the lumbar spine. And then you get into the sacral region, S1 through S5. And so the lumbar plexus, we're concerned with L2, L3, L4. And so in particular, being able to recognize that and draw this, that the femoral nerve and the obturator nerve are coming from L2 to L4, and basically different branches of that. Okay, but femoral nerve is going to be our anterior thigh innervation. The obturator nerve is medial thigh. Sciatic nerve down here is posterior thigh. There's not too much to know here other than to be able to draw it out. And then the sacral plexus, we do have a nice method of drawing this out. And so we know that the sacral plexus is from L4 to S4, and we write out the sacral plexus, or remember it by starting with L4, then we write L5, S1, and then we write in sets of 3. So we have L4, L5, S1, right? These are the different vertebrae of the lumbar region and into the sacral region. And so, the sacrum's fused together, but S1, S2, S3, S4, S5. Okay, so L4, 5, 1, that's a set of 3. Then we write 5, 1, 2, 1, 2, 3, 2, 3, 4, 3, 4, and 5. Okay, and so the next step is to go ahead and draw in our divisions. So after every column, we draw a vertical division right here, and then we draw a horizontal division at the top, right there. And then our second mnemonic to go with this after we've drawn the sets of the vertebrae is SIPS, so S-I-P-P-S. And then the first one is for superior gluteal nerve, and this is also gives rise to the nerve to the quadratus femoris, which is in the gluteal region, and then the inferior gluteal nerve and the nerve to the obturator internus, and then the posterior cutaneous nerve of the thigh, the pudendal nerve, which is for sphincters, and we haven't been concerned with that yet, and then the sciatic nerve, which is going to be the back of the thigh. Okay, so now that we have the lumbar and sacral plexus, we're going to take a look at the muscles of the gluteal region, and then we'll take a look at the muscles of the posterior thigh. All right, so the gluteal region muscles, there's 10 overall, and remember that as, if you were to grab somebody's butt, you would grab it with both hands, so 10 digits. There's a little bit of a caveat to this, which is the tensor fasciae latae, you could really consider to be, it's kind of on the lateral side of the thigh, extends in the posterior region, so we consider it kind of anterior thigh and posterior, gluteal region. So 10 with a caveat, but 2 hands to grab a butt, not the best way to remember it, but it is what it is. All right, then we use glute and underline T to remember that there's 4 muscles in the sort of more superficial area of the gluteus. So we have the gluteus maximus, the gluteus medius, and the gluteus minimus. And maximus is the most superficial, medius is superior to the minimus, and then we have the maximus is innervated by the inferior gluteal nerve, and then superior gluteal nerve for the gluteus medius minimus, and then the tensor fasciae latae. And we'll look more at this a little bit in the future, but the maximus extends and laterally rotates the thigh. The medius and minimus are going to do abduction and medially rotate the thigh, and then the tensor fasciae latae is going to do abduction, medially rotate the thigh, and then also flex the thigh. Okay, then we have the lateral rotators of the thigh. These are deep to the gluteus maximus, and we have our mnemonic is P, go, go, Q. So P, go, go, Q. And then this is from superficial here. This should be superior to inferior. This is the order, P, go, go, Q. Piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, quadratus femoris. And then our obturator externus, we also said in lab 7 that we could consider that to be medial thigh as well, because it's on the other side, the interior part of the obturator foramen. All right, so P, go, go, Q, not too bad. For the piriformis, this being the most superior of the lateral rotators of the thigh, it's the nerve to the piriformis, which is S1, S2. And then for the other ones, we group them by go, and then G and Q for the innervation. And so go, the second one is obturator internus, so the nerve to both of these is going to be the nerve to the obturator internus, and we look here, the inferior gluteal nerve and nerve to the obturator internus, so this is going to be L5 to S2. All right, L5 to S2. And then gemellus inferior to quadratus femoris. So the second one here is going to be quadratus femoris, and so the nerve to the quadratus femoris is also going to innervate gemellus inferior. And so nerve to quadratus femoris right here is going to be L4, that's L4 to S1. Okay, and then the obturator externus, we're skipping because we said, we really consider this to be more medial thigh, but it fits with our mnemonic well, which is why we've kept it in. So let's take a quick look at what these muscles look like before we go on to posterior thigh. So this is still gluteal region. Okay, so here we have the gluteus maximus, and we can see that its insertion is along the sacrum, and then the edge of the, or the origin is along the edge of the ilium up top, so posterior to the posterior gluteal line, right along that top part. And then we see it inserts into the IT tract, and then it inserts, so you can see right here, onto the femur on the gluteal tuberosity. Okay, so I'm going to go ahead and hide that one. Deep to that, we have the gluteus medius, and the gluteus medius is going to insert on, or its origin is the ilium between the anterior and posterior gluteal lines, and it's inserting on the lateral aspect of the greater trochanter of the femur, which is right, zoom the way in right there. Okay, and if I go ahead and hide that, we'll see that deep to it we have the gluteus minimus. All right, then moving down towards the feet, we have the piriformis, P, go, Q. So next one would be gemellus superior, and then P, go, Q. So the next one should be an obturator internus. Okay, and then below that, it's a little bit hard to see here, but we have another G for gemellus, so this is the inferior gemellus. And then we have another O, which would be the obturator externus, which we said is actually medial thigh. So if we sort of look on this side, the obturator externus is on the obturator, its origin is on the obturator fossa, and it's on the anterior side, whereas the obturator internus is on the posterior side. Okay, and then so we have our Q, and our Q is quadratus femoris, right? So, based on their attachments, you can see that, right, if this were to go ahead and contract, we would have lateral rotation of the hip, right? And so lateral rotators is what this, lateral rotator of the thigh, excuse me. That's what that does. All right, then we have our posterior thigh, which is our hamstrings. Fortunately, there's only 3 muscles, and remember it with SSB. Don't have a great way of, memorizing other than that, but this goes from medial to lateral. How can you remember medial to lateral? Well, the first one from in to out, medial to lateral, is membranosus. So semimembranosus, and then second S is semitendinosus, and then you have the biceps femoris, and the, as we said when we went back to our sacral plexus, the sciatic nerve is going to give us the posterior part of the thigh. So the tibial division of the sciatic nerve is giving us innervation for semimembranosus, semitendinosus, and then the long head of the biceps femoris, and then the other head of the biceps femoris is the common fibular division of the sciatic nerve. All right, let's see if we can find those real quickly. All right, so from medial to lateral, we have our semimembranosus right here. Let's see, try to give a view of it. All right, so semimembranosus, semitendinosus, and then we have our long head of the biceps femoris, and then we have the short head of the biceps femoris. Right, not too bad. All right, let's move on. Okay, so can you summarize the borders that define the gluteal region, posterior thigh, and popliteal fossa? The gluteal region is pretty straightforward. Laterally, you have this line, the greater trochanter of the femur. You could also say the iliotibial tract, right, this guy, which goes down the lateral portion of the thigh. You have superiorly the iliac crest, medially the natal cleft, which is the edge of the butt cheeks, and then you have the gluteal fold inferiorly. Okay, popliteal fossa we're going to go over towards the ends. Posterior thigh we'll cover as well. Popliteal fossa is right here, of course. All right, cutaneous innervation of the gluteal region, posterior thigh, and popliteal fossa. So for the gluteal region, you have the medial cuneal nerves, which comes from the dorsal rami of S1, S2, S3. And then you also have the superior cluneal nerves of from the dorsal rami of L1, L2, and L3. And then you also have the inferior cluneal nerves, and you have perforating cutaneous nerves of S1, S2, S3. So really, S1, S2, S3 of the sacral plexus is going to cutaneous innervation. Then you have the posterior femoral cutaneous nerve for the posterior thigh. So the posterior cutaneous nerve, which we saw from the lumbar, or from the sacral plexus, and branches of the lateral femoral cutaneous nerve, so femoral nerve. And then you go a little bit further down, we have the obturator, so cutaneous branches the obturator nerve, and we said that the obturator nerve is innervating medial thigh, medial compartment of the thigh. And then in the popliteal fossa region, you have the posterior femoral cutaneous nerves. All right, if we look at the vein, we have the accessory saphenous vein here, the great saphenous vein. If you remember from the previous lab, the great saphenous vein was the one that was on the interior side of the thigh on top of the fascia lata, and it went into our femoral triangle, and we used the great saphenous vein to find the femoral triangle, in fact. And so here we have a continuation of the saphenous vein, we have a branch off of it, and then we have the small saphenous vein coming as a branch off of the popliteal vein coming from the popliteal fossa. All right, so can you discuss structures that pass through the greater and lesser sciatic foramina? So the greater sciatic foramen, we have the superior gluteal nerve, artery, and vein, the inferior gluteal nerve, artery, and vein, the sciatic nerve, the posterior cutaneous nerve. So basically everything from our sacral plexus, and then we have our pudendal nerve, which we said again was for sphincters. We're not really concerned with that so much, but poo, right? Poo, sphincter, butthole. Easy to remember that. And then nerve to the obturator internus for lesser sciatic foramen. And so you can follow these arrows to see that these ones in fact do still go through the greater sciatic foramen as well. All right, and then of course we have the sacral tuberous ligament, which is responsible for creating our lesser sciatic foramen, and then our sacrospinous ligament, which is making our greater sciatic foramen. Okay, not too bad. Can you visualize the muscle attachment sites on the skeleton or bones at your table? So we have our gluteus maximus, which is primarily doing thigh extension, right? And so that's, if you're looking at a person from the side with their foot facing the edge of their foot this way, extension of the thigh is going to be moving the leg that way, backwards. All right, then we have our gluteus medius, minimus, or abductors, and so is the tensor fascia lata. We also said that they were going to do some rotation of the thigh as well, which we'll cover. And then we have our lateral rotators, which is our P, Go, Q, which are listed here. Okay, not too bad. We have our gluteus maximus here, which we went over, but notice it inserts in the iliotibial tract, and then the gluteal tuberosity, not that bad. Signs and symptoms of weakness. This is, even though it's the maximus, the gluteus maximus is innervated by the gluteal nerve, and so weakness or injury would be weak thigh extension or lateral rotation. All right, gluteus minimus maximus, they abduct, abduct, and immediately rotate the thigh, and they're both innervated by the superior gluteal nerve. They are attached to the external surface of the ilium for the gluteus medius, and then the lateral surface of the ilium for the gluteus minimus. And then they both insert on the greater trochanter. Gluteus medius is on the lateral surface of the greater trochanter, and the gluteus minimus is the anterior surface for the insertions. All right, muscles of lateral external rotator group. Remember, this is P, Go, Q. So piriformis, gemellus, obturator internus. Then we have gemellus inferior, then obturator externus, which we said is on the anterior side, so we consider it more of a medial thigh muscle. And then we have the quadratus femoris. And then to go over the innervation, the piriformis is by itself, nerve to the piriformis, S1, S2. And then we have GO, it's the second one that matters in each of these groups in terms of naming the nerve. So gemellus superior and obturator internus, it's the nerve to the obturator internus that innervates the gemellus superior and the obturator internus. And then likewise, we have the nerve to the quadratus femoris is what innervates the gemellus inferior and the quadratus femoris. And then we can look at our diagram to figure out what vertebra level those come from, which we'll do right here. So, we've redrawn this here. This is the sacral plexus. And so we have, what are the origins on the sacral plexus? Superior gluteal nerve, we look right here. That's L4, L5, S1. Inferior gluteal nerve is L5, S1, S2. So L5 to S2. Then we have our nerve to our obturator internus, exact same thing, L5 to S2. And then nerve to quadratus femoris right here is L4 to S1. And then the sciatic nerve down here is our unusual one. We have to draw our diagonal. And so that's L4, L5, S1, S2, S3. So L4 to S3 for our sciatic nerve, which again, sciatic nerve is posterior thigh. All right, can you describe the arteries in the gluteal region? So we have our superior gluteal artery and vein, and that breaks off into the deep branch and the superficial branch. Then we have our inferior gluteal artery and vein, and that's going to eventually connect to the perforating parts of the deep femoral artery that is coming through our, there's tiny foramen in the abductor magnus, which is one of our medial thigh compartment muscles. Okay, so not too bad. Another thing to note is that the deep branch of the superior gluteal artery is going to meet up with the lateral femoral circumflex artery. All right, so posterior thigh is our hamstrings. We said it was SSB, semimembranosus, semitendinosus, biceps, and we have the two heads, the long and short head of the biceps femoris. They are going to overall work on thigh extension. So again, what is that? That's when this is our foot. Our thigh is moving backwards, but they also can do medial rotation in terms of the semimembranosus, semitendinosus will do medial rotation. The biceps femoris is going to, you can see that the biceps femoris attaches on this side, and so whereas our semimembranosus and semitendinosus attach on the medial side and will do medial rotation, the opposite is true for our biceps femoris. Again, they're all doing extension of the thigh, but the biceps femoris will do lateral rotation. As we can see, it's attached on the lateral side. All right, and then in terms of origins, we can see that the long head of the biceps, the semitendinosus, semimembranosus, they all are attached for their origin at the ischial tuberosity, and then their insertions are a little bit different. So semitendinosus is on the medial proximal tibia, right? So pes and serinus. And then the semimembranosus is on the posterior medial tibial condyle, which is going to be right here. Okay. Then we have the biceps femoris. It's going to be attaching down here on the fibula, and the short head is going to do the same thing. All right. In terms of innervation, we said posterior thigh sciatic nerve, and so for all of these, it's the tibial division of the sciatic nerve, but the short head is the common fibular division of the sciatic nerve. All right, we're going to quickly pause right there. It's an arterial supply of the posterior thigh. Again, this is sciatic nerve, so there's not much to say here, but tibial division for everything, fibular division for the short head of the biceps femoris. And then this is just another look at the some of what we talked about before, as we talked about the arteries in the gluteal region. We can see that the deep branch of the femoral artery is coming through the adductor magnus muscle right here. And you can see that that is meeting up with the inferior gluteal artery. And then remember from the previous lab, we had femoral artery eventually becomes the popliteal artery as it goes, after it goes through the adductor hiatus in the adductor magnus. Okay, so not too bad, we're almost done. Boundaries of the popliteal fossa, really just memorizing it, but it's good to know we have the semitendinosus muscle is superior medial, then we have inferior medial, this is next lab stuff, but the gastrocnemius muscle. Inferior lateral is the lateral head of the gastrocnemius, then superior lateral is the biceps femoris, long head, and then the roof, we have the fascia, the popliteal fascia, which is a continuation of the fascia lata that covers the thigh region. Okay, so not too bad, that's the roof. The floor is the knee joint capsule and also the popliteus muscle, which we'll cover in the next lab. Another important thing to note is, in the back here, we had the sciatic nerve from our sacral plexus. Sciatic nerve, as it continues down through the popliteal fossa, becomes our tibial nerve. And we have the common fibular nerve branch off of that. All right, so going back here, tibial division of the sciatic nerve. And then we have the tibial nerve coming from our sciatic nerve overall, so just being renamed. And then one of those branches is going to be the common fibular nerve. All right, so sciatic nerve becomes tibial nerve overall, gives off this important branch, common fibular, and then these important branches right here, the tibial division of the sciatic nerve, which is going to innervate most of the posterior thigh. All right, so what's in the popliteal fossa region? We have the artery, we have veins, we have lymph, and the small saphenous vein is going to be a branch of the popliteal vein. Not too bad. When we're looking at the hip region here, we break it up into quadrants. So we look at the highest point on the iliac crest, which you can palpate, and then draw a vertical line down from that. Then we have a second horizontal line through horizontally across the bottom of the ibial tuberosity, and then another horizontal line here. And so you get the upper lateral quadrant, the upper medial quadrant, lower medial, and lower lateral quadrant. And we use the upper lateral quadrant for safe injection sites so that we can avoid the sciatic nerve and any vessels that are going to be passing through the foramens here. Okay, so not too bad. And then one last thing, we have the so unusual gaits. There's the Trendelenburg sign, which is when you have an injury to the superior gluteal nerve, which remember innervates the gluteus medius and gluteus minimus. And so if you have an injury to those such that the gluteus minimus and gluteus medius freeze, what you're going to have is a pelvic drop on the opposite side of where there's damage. So if it's damaged here, you're going to have a drop over here as the body tries to compensate for those frozen muscles. All right, so that's it. We're going to take a quick look at the surgical case, and then we'll be done for this lab review. All right, so just quickly going over the surgical scenario for lab 8. Jenny is a 37-year-old female presenting in the clinic with a painless left knee mass. She reports restricted left joint movement that has been ongoing for 6 months. On radiograph, a left distal femur lesion was identified, which raises concern for an osteosarcoma. On a chest CT, no metastases are identified, and histology identifies a periosteal low-grade spindle cell tumor with woven bone formation. Periosteal osteosarcomas are typically low-grade lesions treated with surgical resection without chemotherapy or radiation. Okay, so basically, there appears to be a low-grade tumor on the periosteal, which is connective tissue that covers bone, and it's done with surgical resection, which just means they cut out the tumor, and then they don't treat with the chemicals using chemotherapy delivered through the blood or radiation, such as proton radiation, etc. Okay, so in a posterior distal femur surgical resection, what muscles must be displaced to expose the posterior femur above the popliteal fossa? So I believe that since we're talking about the popliteal fossa, first thing that should come to mind are, what are our boundaries? And then we also are dealing with posterior thigh region, so posterior thigh muscles. So, we have SSB, semimembranosus, semitendinosus, and then the biceps femoris. And so if we want to expose the popliteal fossa, we need to move the biceps femoris laterally, and then the membranosus and semitendinosus must be moved medially. Question 2, what nerve moves laterally through the popliteal fossa after the sciatic nerve divides? All right, so remember that the sciatic nerve breaks into the tibial and common fibular. A key here is lateral, so just palpate your leg, right? And that big bone you feel in the center of your leg, that you feel that big ridge, right? That's the tibia, right? And then that's more medial on your leg. And then if you feel the other side of your leg, you feel the fibula, and that is the lateral side. And so the sciatic nerve breaks up into the tibial nerve, which is, I'd consider that kind of just going straight through the popliteal fossa down the tibia, and then lateral breaks into the common fibular nerve. So our answer is the common fibular nerve. is related to the tendon of the biceps femoris muscle as it travels laterally through the popliteal fossa. All right, not too bad. Good job, guys. Done with another lab.